For most patients with gout, what strikes the most about this disease is the severe attacks of joint pain it causes. They dread those attacks primarily due to their severity and also due to the abruptness with which they come. However, these painful attacks are not the scariest thing about gout. It is important to dig into the scariest and most life-threatening facts about gout so that its real nature can be understood. The awareness of these facts will serve as an eye-opener and motivate you further to take the right steps to inhibit the progress of this condition. So, let's have a look at the 5 most scary and life-threatening facts about gout. The purpose of sharing this information is not to scare you, but to give you an idea of why it is so important to not ignore gout and get treated for the same in the right manner. Number 1. Joint deformities. Most patients diagnosed with gout know that they are likely to get recurring attacks of severe pain and swelling in the joints. They also know that the pain tends to subside slowly over 4 to 5 days. This is followed by a period of remission during which they do not get severe symptoms. While this kind of understanding about gout is true, it can cause you to miss out on vital information about this condition. What patients do not realize is that every attack of gout leaves behind significant damage to the joint that is irreversible to some extent. So even though the pain and swelling in the joint do resolve within a few days, the joint damage persists and becomes worse with every next attack. If the cause of gout is not treated, these acute attacks can come up more and more frequently, and so even the joint damage would keep progressing, leading to the erosion of the bone. Over a period of time, it may also lead to the loss of cartilage, gradually causing the complete destruction of the affected joint. The joint damage is further accelerated by the formation of tophi in the affected tissues. Tophi are formed by the deposits of urate crystals that get accumulated under the skin, especially when chronic gout is not treated in the right manner. Tophi can occur in several parts of the body, including the hands, wrists, feet, ankles, and ears. Tophi often feel like hard lumps under the skin. Although they are not very painful, they can become inflamed and swollen during gout attacks. Also, as tophi become larger, they erode the joint tissues and surrounding skin. This can contribute to the joint damage, eventually leading to faster joint destruction. This can affect the range of movements to the joint to a great extent, thus preventing you from performing your routine activities with ease. These long-term complications of gout are often ignored by patients due to the excessive focus on just managing the painful episodes. If left ignored, the joint damage can lead to scary consequences with severe deformities. Number 2. Kidney failure. Gout basically occurs due to the formation of urate crystals as a result of the increased level of uric acid released during metabolism. Other than the joints, these urate crystals can get deposited even in the kidneys, causing kidney stones. Kidney stones are known to cause severe abdominal pain. The pain can be so severe that it may require you to visit a hospital's emergency room or undergo surgery or other advanced treatments for the removal of the stone. If not treated properly, the high concentration of urate stones in the kidneys can interfere with the functions of this vital organ. Over a period of time, these stones can cause damage to the kidneys, putting you at risk of chronic kidney disease, or KCD, that sometimes ends in renal failure. This shows that if you are not careful about managing your uric acid levels for controlling gout, this condition can do serious collateral damage to your kidneys. Once renal failure develops, you may need to undergo regular dialysis, a type of treatment in which the blood from the body is passed through a dialysis machine, which filters the blood just like the kidneys. The blood is then infused back into the body. It should be noted that in spite of the availability of the advanced treatments like dialysis and kidney transplant, renal failure still carries a high risk of mortality. This again emphasizes the need to get properly treated for gout in order to prevent the impact of this condition on your kidney health. Number 3. Heart diseases. What makes gout a scary condition is its impact on the functions of the heart. You will be surprised to know that gout, if not treated properly, can also increase your risk of heart diseases, including hypertension, coronary artery disease, and even cardiac heart failure. These consequences are primarily linked to the changes in the metabolic processes that cause gout. Additionally, the effect of gout on the kidney functions and the hormonal imbalances caused due to mental stress is also believed to contribute to the higher risk of heart diseases in gout patients. High blood pressure, coronary artery disease, and congestive cardiac failure are known to predispose a person to life-threatening conditions like stroke and heart attacks. congestive cardiac failure can occur when the heart fails to pump blood effectively. This can cause scary and disturbing symptoms like swelling in the legs and the inability to breathe well. The higher incidence of hypertension, coronary artery disease, and cardiac heart failure in gout patients form a scary picture of how this disease does not stop at just affecting your joints. Number 4. Psychological problems. The episodes of joint pain caused due to gout can interfere with your everyday activities and reduce your productivity and efficiency at home and workplace. Moreover, gout attacks usually come up at night, so they are likely to prevent you from sleeping well, causing you to feel dull and drowsy during the daytime. The lack of sound sleep can also lead to a variety of other issues, including fatigue, anger, irritability, increased stress, and mood swings. This is why patients with gout are often stressed even during the periods of remission when they have no symptoms. The stress and anxiety may occur due to the fear of getting an attack at any time. These symptoms can prevent them from enjoying their life. They also prefer to spend their weekends at home and avoid going on vacations. Additionally, patients with gout also experience confusion about the foods they should eat or avoid in order to ensure their diet does not contain purine. These factors can add to their woes and cause frustration and anger. All these symptoms, coupled with the joint pain, can also prevent them from focusing on important tasks. This shows that gout can also affect the emotional health of a person, reducing his or her mental and intellectual abilities. The stress may continue to build as the flare-ups occur frequently, thus raising the risk of depression, panic attacks, and anxiety disorders. This can affect the quality of your life to a great extent. The symptoms of depression, such as the feeling of loneliness, the tendency for self-harm, and suicidal attempts, need to be highlighted to create awareness about the scary and life-threatening facts about gout. Not just the patients, but even their family members need to be educated about these lesser-known complications of gout so that they can take necessary precautions. Number 5. Premature death. The risk of mortality due to various causes is found to be higher in patients with gout. It is estimated that gout patients have a nearly 25% higher likelihood of premature death than those without gout. The higher risk of mortality could be linked to how this condition affects the heart, kidneys, or the mental health of the patient. In some cases, a multitude of factors may contribute to the risk of mortality. This is why it is important to be aware of why gout occurs and what you can do to control it in order to protect yourself against the scary and life-threatening consequences linked to this disease. Gout is a metabolic disorder that can be managed easily by making some healthy changes in your diet and lifestyle. Instead of feeling anxious about the complications this condition can cause, you should focus on getting the right advice related to your diet, lifestyle, and medication so that you can avoid the serious, life-threatening complications. If you are concerned about your gout problems and are looking for ways to prevent your next flare-up, we highly recommend you to check out our YouTube channel to learn the different ways to fight against gout. Now, if you've enjoyed this video and it helped you learn more about gout, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new life-saving video, you'll get notified right away. Till next time.